am William Evans Mtawazi, and this is the news in details. Rwanda has received an additional 160 specialist teachers from Zimbabwe under a teacher exchange agreement between the two countries. The teachers arrived in Rwanda on Sunday afternoon, and the cooperation agreement between Rwanda and Zanzibar, signed 3 years ago, allows for the exchange of skilled professionals in key sectors including education, health, and information and communication technology. The 160 specialist teachers who arrived in Kigali had earlier undergone orientation and preparation training in Harare to equip them for their new assignment in Rwanda. They join another 154 Zimbabwean teachers who have already been deployed to Rwanda over the past 3 years. The government of Zimbabwe says the teachers are pleased and motivated to be working in Rwanda. Relations between Rwanda and Zimbabwe continue to strengthen, with more than 30 cooperation agreements signed in areas such as police cooperation, energy, health, tourism, education, and information sharing. In December 2021, the two countries signed an agreement committing to supporting each other by deploying experienced professionals whenever needed. Under this arrangement, Rwanda agreed to receive a total of 477 teachers from Zimbabwe. Now, health experts say that the decline in maternal and newborn deaths is largely linked to the increased uptake of family planning services. This follows findings from the 7th Rwanda Demographic and Health Survey, DHS-7, which shows that 78% of the women in need of family planning are accessing services, although 9% still do not have access to a method that suits their needs. We do have details to this report. There is visible satisfaction among parents we met at Nyagasambu Health Center in Rwamagana district, who say family planning has helped them improve maternal and child health outcomes. When I gave birth to my first child, I felt no need to use family planning tools. However, after my second baby, I chose to because these two followed each other very early. I find family planning good because it helps with spacing between children. I gave birth to my first child when I was not staying with my husband. That in itself gave me a lesson not to give birth to many children so that I am able to take care of them well. A nurse at Nyagasambu Health Center, Alphonse Mbateye, says that overall participation in family planning, especially among women, has increased significantly. We have worked together with other healthcare providers to encourage people, especially mothers, to consider family planning. It is in that regard that the numbers have increased, even when a big number of men are not yet fully engaged. According to DHS-7 findings, 60% of women use modern family planning methods, 5% rely on traditional methods, while 9% remain without access to family planning services, mainly because available methods do not meet their needs. Health professionals note that the rise in family planning use has played a major role in reducing maternal and newborn mortality, a view shared by Dr. Nhirushwa of Legacy Clinics.
Family planning has a lot of advantage, and it's at all levels. It's from the nation, from the hospital and the healthcare system, but also for the family and the communities. So if I start by the national level advantage of family planning, this includes better economic growth. So why this? When we have mothers who cannot conceive when they really want, or just family who cannot control that, there is increased risk of maternal mortality and newborn mortality. And those happens because if they're pregnant, of course, this is the time when this can occur, especially when they are not ready. They can be having some disease. They may not be prepared for that, and the complications are more. So that is one of the main things. And as you understand, one of the wealth of a nation is its population. So when newborns are healthy, that's a huge advantage for the country. So other special advantage that we see is related to productivity, because if you have, again, families, if you have mothers who can plan when they want to conceive and to get pregnant, it means that they are more healthy to contribute to economic growth. So that is key for the nation.
The DHS-7 further shows that the proportion of women without access to family planning services has dropped to 9% in 2025, down from 36% in 2000. The Minister of Health, Dr. Saben Nsanzimana, says the government is intensifying efforts to close the remaining gap and ensure equitable access to family planning services. Where we are now focusing our efforts is in how long you spend at hospitals after delivery and the quality of services you are offered. Even when we are doing good statistically, we shall not stop working harder. We are seeing how to make more improvements as we seek to make healthcare much better. Earlier surveys conducted in 2005 indicated that the fertility rate stood at 6.1 children per woman. The latest DHS findings show that fertility has declined between 3 and 4 children per woman, highlighting significant progress in reproductive health outcomes. Now, public health experts are calling for increased efforts to combat non-communicable diseases as their continued rise is claiming the lives of many people worldwide. This follows the release of the World Health Organization's 2025 report, which shows that non-communicable diseases now account for 74% of all deaths globally. The report highlights that developing and low-income countries are the most affected. As awareness of these diseases grows, more people are beginning to understand their seriousness. Concerns have increased as many witness relatives and community members affected, prompting some to seek medical checkups at health centers and clinics to assess their health status. In Rwanda, 2024 data shows that non-communicable diseases, mainly diabetes, heart diseases, and other chronic conditions, counted for 47.7% of deaths. Communicable diseases such as HIV, stroke, AIDS, and malaria accounted for 42.9%, while injuries largely linked to road traffic accidents made up to 9.4% of the deaths. Minister of Health, Dr. Saben Nsanzimana, says that this is a global challenge, but notes that the government of Rwanda has put in place measures to address the growing burden of non-communicable diseases. Beyond Rwanda, the World Health Organization report indicates that non-communicable diseases were responsible for 74% of all deaths worldwide. In 2021 alone, these diseases claimed more than 43 million lives, with 18 million deaths occurring among people under the age of 70. Developing and low-income countries accounted for 73% of these deaths, representing 33 million lives. Under the second National Strategy for Transformation, NST2, the government of Rwanda plans to intensify public awareness campaigns on prevention, deploy trained health workers within communities, and scale up nationwide screening programs to reduce deaths caused by non-communicable diseases. Let's now go to Bugesera, where residents of Bugesera district said that they are making 25 years since they overcame the devastating famine of the 2000. At the time, severe drought turned Bugesera into one of the hardest hit areas in the country, causing prolonged food shortages due to very low agricultural production. Large parts of the district resembled a desert, with vast area lacking trees. To address the crisis, the government prioritized large-scale tree planting as a long-term solution. Despite the presence of lakes, including Lake Chohoha, water was not being used for irrigation during that period, leaving farmers vulnerable to drought. Today, Bugesera tells a different story. The same sun that once worsened suffering is now being harnessed through government-supported solar-powered systems installed on farms. These systems pump water from Lake Chohoha into constructed reservoirs, supporting what is now known as smart agriculture. In addition, wetlands were developed and residents were encouraged to cultivate them. Some farmers are now producing crops along the banks of the Akagera River. what once defined Bugesera is no longer its reality. Drought is no longer a lived experience. Residents say future generations will Residents say that future generations will study about this, but will never leave them. The same measures are also being considered for districts such as Kayonza, which continues to face intense heat. Bugesera now stands as a clear example of what is possible when communities confront the effects of climate change through planning, innovation, and resilience. Now to more news, the National Council of Persons with Disabilities, NCPD, is urging parents of children with disabilities to stop hiding them, saying there are specialized services, including schools, designed to support their development when they are brought forward. We do have details to this story.
In Ngara Cell, Bumbogo sector, we met Mcheshmana and Tuisenje Clementine, two parents raising children with autism. They say they initially struggled to accept their children's condition, but later came to understand that children with disabilities are not different from other children and deserve equal care and opportunities. I used to keep my child inside the house, not wanting anyone to see him because of his condition. But now, I know that he's like other children, and being with them makes him so happy. It wasn't easy at all. My heart was full of regret and pain. I actually wished I could die. I used to keep him inside the house or in bed, and whenever people visited me, I would never show them to him. Yet, when he is with others, he is so happy, and even when he asks me to take him to school, he does it with excitement. The Fund of Love with Action, an organization that supports children with disabilities through education and also empowers their parents with income-generating activities, Kubgimana Gilbert says that the training and guidance parents receive helps them build confidence and enables their children to reach their full potential.
We are organizing this event to welcome the kids with disabilities and their families and their friends and their neighbors to come and celebrate Christmas. Like everyone this December, everyone is celebrating, everyone is going somewhere to eat, for family gathering. But how these people who have been so long time rejected or forgotten, how they are celebrating? That's why Love with Actions is organizing this event to welcome them, to support them. They can enjoy the Christmas and the New Year like everyone in the country.
The Executive Secretary of the National Council for Persons with Disability, Emmanuel Ndaisaba, says no parent should deny a child their rights because of a disability, noting that the government and partners have put in place opportunities specifically meant to support these children. There are even people with capacity, but who still have such mindsets. Some ignore the fact that many of these children could be important if supported. We are therefore asking all parents in this country to take advantage of the many opportunities the country has made available, especially to people living with disabilities. No child should be locked up in a house, or if anyone knows any of such a case, kindly report to the nearest authorities. We need to support these children so that they can develop themselves and the nation at large. In Bumbogo and Duba sectors of Gasabo district, some children with disabilities who had previously been neglected or excluded by their families were identified. This Sunday, they were brought together with others to share a meal and celebrate the end-of-year festives, where their parents also received food supplies and hygiene kits.
Let's now go to Burera district, where students who participated in the 7th intake of the Urungano Itorero at the Nkumba Itorero Center in Burera district said that the civic education they receive will help them become productive and responsible citizens. The 11-day training program brought together 400 young people, including 203 boys and 128 girls, representing youth from across Rwanda as well as those living abroad. Participants said the lessons they gained during the Itorero have strengthened their sense of patriotism, discipline, and commitment to contributing to national development. Addressing the youth, the Minister of Youth and Arts, Dr. Abdallah Utumatwishima, encouraged them to build on the values and knowledge acquired during the training and become role models for others in advancing the country's development. The Urungano Itorero was launched in 2016, and since then it has trained a total of 3,028 young people, including 2,543 from within Rwanda and 485 Rwandans living in the diaspora. Now, Congolese refugees living in Mugombwa camp in the Gisagara district say that their lives have improved through active participation in development activities alongside Rwandans. The refugees, who have spent more than 13 years in exile in Rwanda, said said the country's good governance has enabled them to work hand in hand with host communities in sectors such as agriculture, livestock farming, education, and other income-generating activities that support their daily livelihoods. At Mugombwa Technical Secondary School and other learning institutions, refugee youths continue to access education. Graduates from vocational schools are also able to secure employment, while students still in school commend the government of Rwanda for its inclusive education policy. The mayor of Gisagara district says Congolese refugees in Mugombwa camp are well supported and provided with equal opportunities to participate in development initiatives. One example is Icherechezo Misizi Cooperative, established in 2018, which brings together 1,428 members, including 300 refugees. The cooperative has so far saved more than 14 million Rwandan francs. While refugees say they are settled and progressing like other residents, they continue to call on the authorities of the Democratic Republic of Congo to respect peace agreements so they may eventually return to their homes. Mugombwa camp in Gisagara district currently hosts more than 12,000 Congolese refugees who fled violence targeting Kinyarwanda-speaking communities in the eastern DRC. We now take a short break and return with international news in a bit, shall we?
Nyiri muto arababwiraga data bati ntabwo wagira umukamo mwinshi utunze inka imwe, ariko nigeze acika intege. Mama akinjira mu bucuruzi harabamubwiraga bati ntabwo watera imbere udakorera mu iduka rigezweho, ariko ntibyamusubije inyuma, yakoranaga umwete. Njye muri kaminuza harabanshidikanyagaho bavuga ko nashobora kaminuza naturuka mu muryango wifashije, ariko byarangiye nanditse amateka mashya. Igihe cyo gutera ishema umuryango wanjye kigeze, bamwe bakomeje kumbwira bati ntabwo watera umuryango wawe ibyishimo n'ishema, ariko narabishoboye. Hari abakekaga ko nasigira umurage ukomeye abankomokaho, ariko ubu mfite uruganda rutunganya amata. Banki ya Kigali yabaye umufatanyabikorwa wanjye mu rugendo rwose, inzozi zanjye ziba impamo. Bigereho.
Well, with that, we come to the end of tonight's edition. I'm William Evans Mtawazi, and from me and everyone who is here, we wish you a Merry Christmas, Happy Holidays, and a peaceful New Year. Good night.